Good day, I am Shamelle Tobias from BSN 2-1, and today I am excited to present to you a comprehensive overview of a widely used antibiotic that plays a crucial role in combating bacterial infections, amoxicillin. So, as we know, it is one of the most prescribed antibiotics globally, and it is necessary for us to understand its pharmacological properties, its indication, as well as its contraindications, its side effects, interactions, dosage, and nursing considerations intervention that is paramount for healthcare professionals. Throughout this presentation, we'll delve into each aspect of amoxicillin, so from its mechanism of action to its administration in various patient population. And also, we'll explore its therapeutic uses, the precautions to consider before prescribing, its side effects, and additionally, we'll also touch the importance of nursing considerations interventions, which emphasizes the role of nurses in ensuring safe and effective medication administration. So, furthermore, we'll also take a deeper dive into current research and evidence based practice guidelines related to amoxicillin because understanding the latest advancement and recommendations in the field allows healthcare workers to optimize patient care and improve treatment outcomes. Now we'll dive into the pharmacological properties of amoxicillin. So first, it has a bactericidal action. So amoxicillin directly kills bacteria rather than just slowing their growth. And also, it has a broad spectrum of activity. So it can combat a wide range of bacteria, including both gram-positive and gram-negative types. So it also inhibits bacterial cell wall synthesis and it disrupts the production of the bacterial cell wall, which weakens the structure and ultimately leading to bacterial death. And next, it is also well absorbed after oral administration. So when it is taken by mouth, amoxicillin is efficiently absorbed into the bloodstream, which ensures effective distribution throughout the body to combat infections. And it also has a similar activity to penicillin and ampicillin. So it shares a similar effectiveness and mechanisms of action with penicillin and ampicillin, but it achieves higher concentrations in the bloodstream compared to ampicillin, and it is FDA approved since 1974. Now we'll proceed to the indications of amoxicillin. So it is proven to treat susceptible bacterial infections of ears, nose, throat, genitourinary tract, the skin, as well as the skin structure and the lower respiratory tract. So amoxicillin is also combined with clavulanic acid, which is like a bodyguard for antibiotics because it helps antibiotics to work better by stopping the bacteria from breaking them down. So when we take antibiotics with clavulanic acid, it's like giving the antibiotics a backup to help them fight off the bacteria more effectively. So when combined clavulanic acid and the amoxicillin, it is used to treat for acute bacterial sinusitis, community acquired pneumonia or CAP, acute bacterial otitis media, and urinary tract infections. So after the indications, of course, we have its contraindications. So one of this is hypersensitivity or history of severe allergic reactions to amoxicillin or other beta lactams. So individuals with a known allergy to amoxicillin or any related antibiotics like penicillin should avoid it due to the risk of severe allergic reaction. So this includes anaphylaxis, which is like a super serious allergic reaction. So that happens when our immune system goes haywire in response to something it thinks is harmful. So that is like certain foods or medications or any insect sting. So this reaction can cause trouble breathing, a drop in blood pressure, and even a loss of consciousness. So it is also related with Steven Johnson syndrome, which is a rare but very serious skin reaction. So it often starts with the flu-like symptoms and then leads to a painful rash that looks a bit like a burn. So next we have the suspected or confirmed infectious mononucleosis. So using amoxicillin in patients with infectious mononucleosis, it can cause a specific rash called amoxicillin rash. So that is best to be avoided. So next we have liver disease. So persons with severe liver disease may require dose adjustments or avoidance rather of amoxicillin due to its metabolism in the liver that could worsen the liver dysfunction. Next, we have the kidney disease. So, people with kidney disease or severe kidney disease may require dose adjustments, just like the liver disease, because amoxicillin is mainly excreted through the kidneys, and its accumulation can occur in impaired kidney function. So, next, persons with history of gastrointestinal disease. So, patients with a history of gastrointestinal disease, particularly colitis, should use amoxicillin cautiously because it can disrupt the balance of gut bacteria and worsen symptoms. Lastly, we have people or patients rather with a history of bleeding disorders because amoxicillin may increase the risk of bleeding in individuals with bleeding disorders or those taking blood thinning medications. So now we'll proceed to the side effects of amoxicillin. So I just want to clear out a misconception about side effects and adverse effects because there's always a misconception about these two and they are used interchangeably. And I want to clear that out. And side effects, these are unintended. It is usually mild effects of a medication or treatment that occur with the desired therapeutic effects. So they can be both positive or negative. Positive in a way like a medication for depression also helps with sleep. It also aids us in sleeping. And negative like feeling drowsy after taking allergy medication. So these side effects are common and often expected based on how the medication works. So whereas adverse effects, these are also unintended, but they are generally more serious or harmful effects of a medication or treatment. So, adverse effects can be severe and sometimes life threatening. And unlike side effects, adverse effects are generally not expected based on the medication's intended action, and they can sometimes lead to the need to stop the treatment or seek immediate medical attention. So, now we'll proceed to the side effects of amoxicillin. So, first off, we have nausea, vomiting, or diarrhea may occur. So, as we know, amoxicillin can upset your stomach like any antibiotic and must be drink or must be taken after meal rather. This causes feelings of nausea, making you vomit or giving you diarrhea, mostly when taking antibiotic before eating a proper meal. So next we have prolonged use may lead to oral thrush or vaginal yeast infection. So using amoxicillin for a long time can mess up the balance of germs in our body, which leads to infections like oral thrush, the bacteria in our mouth, or vaginal yeast infections for women. So next we have the serious side effects that may include signs of liver disease or easy bruising or bleeding. So in rare cases, amoxicillin might affect our liver or how our blood clots work, which could make you bruise more easily rather, or have trouble stopping bleeding, which could lead to hemorrhage. So next we have rarely amoxicillin can also cause severe intestinal condition called C. difficile infection or Clostridium difficile infection, which is a type of bacteria that can cause serious infections in our gut when things are balanced in our gut. As normally, these bacteria don't cause problems usually, but if something messes that up, that balance and like taking antibiotics, it can allow the Clostridium difficile to grow too much and cause trouble. So sometimes when amoxicillin can mess up the healthy bacteria in our gut, which allows the bad bacteria like the Clostridium difficile to grow too much and make you very sick with severe diarrhea and stomach pain. That's what the usual feelings or experiences of the patient. So next we have the mild rash is common, but we have to monitor for signs of a severe allergic reaction. So as we know, amoxicillin can cause a mild rash for some people, but in rare cases, it can trigger a severe allergic reaction with symptoms like trouble breathing or swelling on your face. So if this happens, it's crucial to get help right away. So now we'll proceed to the drug interaction. So first off, we have methotrexate. So it could potentially alter the effectiveness or safety of either medication. So just an additional information, methotrexate is a medication used to treat conditions like rheumatoid arthritis, psoriasis rather, and certain types of cancer. So it works by slowing down the growth of certain cells in our body, like those causing inflammation in arthritis or those growing too quickly in cancer. So it is often taken as a pill or given as an injection. So an interaction with methotrexate may occur and could potentially alter the effectiveness or the safety of either medication. Therefore, close monitoring is advised. So next, we have oral anticoagulants, which may cause abnormal prolongation of prothrombin time, and we must monitor them closely. So, oral anticoagulants are medications that help prevent blood clots from forming in our blood vessels. So, examples of these oral anticoagulants include warfarin and apixaban. So, concurrent use with amoxicillin can lead to abnormal prolongation of prothrombin time, which necessitates careful monitoring and possible dose adjustment. So next we have allopurinol. I'm sorry for the allopurinol rather. So it increases risk of rashes when used with amoxicillin. So allopurinol is a medication used to treat gout, which is a type of arthritis caused by a buildup of uric acid crystals in the joint. So this helps prevent the formation of these crystals by reducing the amount of uric acid that our body makes. So therefore, by lowering our uric acid levels, it can help prevent gout attacks and reduce joint pain and swelling. But when used together, allopurinol and amoxicillin may increase the risk of rashes compared to amoxicillin alone. So the exact cause of this interaction is not fully understood, but we'll get back to you for that. So next we have the probenecid. So it reduces renal tubular secretion of amoxicillin, which leads to increased and prolonged blood vessels. So this probenecid is another medication used to treat the gout like the allopurinol, but it works differently from allopurinol by helping the kidneys remove uric acid from the body more efficiently. So by increasing the amount of uric acid excreted in the urine, probenecid can help prevent gout attacks and reduce the risk of uric acid buildup in the joints. But when the probenecid reduces the renal tubular secretion of amoxicillin, it may lead to increased and prolonged blood vessels of amoxicillin when used together. So, in conclusion, for these drug interactions, it emphasizes the importance of informing healthcare providers about all the medications being taken, including the prescription, the non prescription, and the herbal products to avoid potential adverse effects or any treatment inefficacy. So, therefore, always consult with a doctor or a pharmacist before starting, stopping, or changing any medications. So now we'll proceed to the dosage and administration of amoxicillin. So I divided this into three categories. Thanks to my resources, my references that is included at the latter part of the presentation. So first, we have the adult dosage. So for adults, 750 to 1,750 milligrams a day. So it is divided into two dosages every 12 hours. It can be at 12 midnight and 12 noon. So next, we have the pediatric dosage for children or infants over 3 months. So that is 20 to 45 milligram per kilogram a day. So it is divided into doses every 8 hours at 12 midnight, at 8 a.m., and at 4 p.m. So lastly, we have the neonates and infants, which for those 3 months or younger than that. So the maximum dose for this is 30 milligram per kilogram a day. So it is also divided into doses every 12 hours at 12 midnight and 12 noon. So the dosage depends on factors like age, weight, and the severity of the infection. So splitting the dosage helps maintain a consistent level of the medication in the body, which ensures it works effectively against the infection. So, taking the medication at regular intervals, like what I did with my sample, helps to keep the concentration of the drug in the body stable, maximizing its effectiveness in fighting off the infection. So, following the prescribed dosage and schedule is important to ensure that the infection is properly treated and to minimize the risk of side effects or antibiotic resistance. So now we'll proceed to the nursing considerations for intervention. So I divided this into two, the before administration and after administration, because we have to follow certain considerations for before our administration of medication and the after administration of medication. So first off, we will discuss the before administration of amoxicillin. So follow the 10 rights of drug administration to ensure safe patient care. So that includes the right patient, which ensures that we are giving the medication to the correct patient by confirming their identity using at least two unique identifiers like the name and the date of birth. Next, we have the right medication, which to make sure that we have the correct medication prescribed for the certain patient. It is done to verify the medication against the prescription and check the label for accuracy. Next, we have the right dose. That is the third R, or the third right in medication administration. So the right dose of the medication as prescribed by the healthcare provider, we have to double check that and calculate if necessary. So next, we have the right route or the right route. So the administration of the medication using the correct route, whether it be oral, intravenously, or intramuscularly, as prescribed by the healthcare provider or the physician. Next, we have the right time. So we have to give the medication at the correct time according to the prescribed schedule. So we have to pay attention to the timing instructions, such as before meals, with meals, or at bedtime. Next, we have the right documentation. So we have to record the medication as nurses or as the healthcare provider promptly and accurately in the patient's medical record or chart. So we have to include the name of the medication, its dose, its route, its time, and any other relevant information about the drug, and as well as the patient response. And also, we have the right reason for administration. Especially, we have to ensure the medication is being administered for the right reason, meaning it is indicated for the patient's condition and aligns with their treatment plan. So, for the eighth, we have the right response, which is to monitor the patient for any expected or unexpected responses to the medication, whether it be side effects or adverse effects. So we have to be prepared to take appropriate action if adverse reactions occur. And next, we have the right to refuse. So we have to respect the patient's right to refuse the medication. So we have to provide them with informations about the medications and its purpose and document their refusal appropriately. Lastly, we have the right education. So we have to provide the patient with information about certain medication being given to them, which includes its purpose, its dosage, its potential side effects, and any special instructions rather for administration. So therefore, we have to encourage them to ask questions to us and address any concerns that they may have. So next, we have to assess the patient's vital signs prior to administration. So it is essential for us to check the vital signs to ensure that the patient is stable and can tolerate the medication. So next, we have to assess allergy history before treatment to prevent giving a medication that could harm the patient. So next, we have periodically monitor renal, hepatic, and hematologic function. So this step helps catch any problems earlier than we can expect and prevents complications. So next, we have monitor electrolyte balance to ensure that the patient's body functions properly. Next, we have monitor for signs of anaphylaxis, skin rash, and antibiotic-associated diarrhea. So we have to watch out for those signs or those allergic reactions or any side effects, which allows for prompt treatment if necessary. Lastly, we have to instruct the patient about the possible side effects and report immediately. We have to inform the patient about the possible side effects to empower them to recognize and report any issues leading to better care. So this nursing considerations intervention, whether it be before administration or after administration, in my perspective, these considerations should be performed in a sequential manner to ensure that no considerations were left behind in order to ensure that an evidence-based practice was done to improve nursing practice. So after the before administration, of course, we have the after administration. So first off, we have to monitor for therapeutic effectiveness, such as the response to the medication or the certain medication administered, which helps us ensure that the medication is doing its job and the patient is getting better, which is what we all want for the patient. So next, we have to monitor for adverse reactions such as rash, itching, swelling, or difficulty breathing. So these are adverse reactions and side effects which allows for quick intervention if the patient has a bad reaction to a certain medication. So next, we have to evaluate for super infections such as oral thrush or the vaginal yeast infection, like what I've said earlier, which helps prevent new infections from developing while the patient is being treated. So next, we have to emphasize the importance of finishing the prescribed course of amoxicillin even if symptoms improve. So we have to finish the full course of antibiotics. That is crucial to completely getting rid of the infection and preventing it from coming back stronger or bouncing back to the patient if we stop the medication. Lastly, we have to encourage patients to report any new or worsening symptoms promptly. So, prompt reporting of any of the new symptoms helps catch the potential issues early and ensures that the patient receives timely care. So now we'll proceed to the evidence-based practices related to amoxicillin. So I have two studies regarding the effectiveness of amoxicillin that could potentially facilitate patient care. So the first one is entitled Effect of Amoxicillin Dose and Treatment Duration on the Need for Antibiotic Retreatment in Children with Community-Acquired Pneumonia. So as we know, CAP or community acquired pneumonia is a common respiratory infection in children, which often requires antibiotic treatment for resolution. So recent research has explored the effectiveness of a lower dose amoxicillin and shorter treatment durations in comparison to traditional higher doses and longer duration. And based on my research, this study was made to determine whether lower dose amoxicillin is non-inferior to higher dose and whether 3-day treatment is non-inferior to 7 days. So I have here my reference. So to avoid plagiarism. So first, now we'll proceed to the result of this study. So according to this study, the trial findings suggests that a lower total daily amoxicillin dose may be used in twice daily dosing regimens, especially when prevalence of penicillin resistance pneumococci or pneumococci is low. So, among children with community acquired pneumonia discharged from an emergency department or observational unit or any inpatient ward, further outpatient treatment with an oral amoxicillin at a dose of 35 to 50 milligram per kilogram per day was non-inferior to a dose of a 70 to 90 milligram per kilogram per day, and 3 days was non-inferior to 7 days with regard to the need for later antibiotic retreatment. That's why I divided the dosage and administration earlier for adults, for children, and for infants, because this indicates that the dosage differs or varies from age, the weight, and the type of infection the patient has. So now for the validity, it says here that all primary endpoints were reviewed by an endpoint review committee blinded to treatment allocation to educate whether treatment was clinically indicated and prescribed for respiratory tract infection. So the proportion of children meeting the primary endpoint was obtained from the cumulative incidence at day 28 as estimated by Kaplan-Meier methods accounting for loss to follow up. So in this study, children were randomized 1:1 to receive oral amoxicillin at a lower dose or a higher dose in a longer duration and a shorter duration. That's what I said earlier, that the dosage refers to or varies from person to person, and it is not inferior if your dosage is lower or higher than the others with pneumococcal disease. So, will the results facilitate patient care? So, the findings of this study on lower dose amoxicillin and shorter treatment duration in children with CAP or community acquired pneumonia have significant implications for nursing practice and patient care. Why? So, by incorporating evidence based practices like this, such as optimizing treatment regimens, reducing antibiotic exposure, improving patient compliance, enhancing resource utilization, and empowering shared decision making, nurses can contribute to improve outcomes and quality care for children with CAP. So we have to embrace these evidence-based practices that is essential for ensuring the delivery of a safe, effective, and patient-centered care in pediatric nursing, like the one studied in this case. So this is another study that I researched on, which I think is deeply connected with my drug study about amoxicillin. So this is entitled Amoxicillin, a broad spectrum antibiotic. So this is my reference to, again, to avoid plagiarism. And so amoxicillin is a widely used broad spectrum antibiotic known for its effectiveness against a variety of bacterial infections. However, there is a recent research that has shed light on both its strength and limitations, particularly in comparison to other antibiotics with the penicillin class. So, the results of this study is that amoxicillin, with its comparable clinical efficacy to other antibacterials and favorable dosage, pharmacokinetic profile, and tolerability, is an excellent candidate to treat various infectious diseases. So, as it is less effective against gram negative organisms and bacterial resistance developed to the drug candidate, it is one area where major development is required. Therefore, progression in work is also required to investigate new routes of administration and dosage form with more efficacies to reduce the dose and associated side effects. So, for its validity, in a study, responses of bacteria were exposed to amoxicillin and ampicillin at continuously decreasing levels with half-life values. So, for example, in E. coli or Escherichia E. coli, if my memory serves me right, so the kill rates were higher with amoxicillin than with ampicillin, with exponential bacterial or bactericidal response. So, for Staphylococcus aureus, on the other hand, the rates of kill were similar with both agents, but amoxicillin had the long bacteriostatic phase, which was not seen with ampicillin. So this led to a longer lasting antibacterial effect and reduction to a lower total count with amoxicillin with 60. So, lastly, will the results facilitate patient care? So, amoxicillin is very closely related to ampicillin. So, we know that. And with the same spectrum of activity and potency, but it is much better absorbed when given orally, achieving blood concentrations approximately twice as high as those obtained with ampicillin. So, will the results facilitate patient care? Yes, so by recognizing amoxicillin's differential effectiveness against gram-positive and gram-negative organisms, nurses or future nurses like me can tailor treatment plans to target specific bacterial infections more effectively. Moreover, comparisons with other antibiotics with the penicillin class highlights amoxicillin's unique therapeutic profile, guiding antibiotic selection in clinical practice. So as we come to the end of my presentation, these are my references for this drug study presentation. As we conclude, let us remember the critical role that amoxicillin plays in combating infections and improving patient outcomes. Therefore, with careful consideration of its use and adherence to best practices, we can continue to harness the therapeutic potential of amoxicillin while minimizing risks and maximizing benefits for our patients. Thank you for listening. And once again, I am Shamelle B. Tobias from BSN 2-1.